Hi, everyone. A discussion about medical problems associated with handling and restraint would not be complete if we did not talk about some basic wound care for, oh, yes, you, the handler. And this is kind of my approach. So they're guidelines and tips. They are not to replace medical advice or overrule any of your sensitivities or allergies. It's just a very common sense approach to dealing with standard wounds, such as bites that you might experience while working with animals. Let's start with that no-no list, what not to do. Now, most of the time we say no sucking on it, and the reason is because animals, nails, teeth, etc., saliva, all has germs and bacteria in it, dirt and debris, maybe even fecal contamination that we do not want to put into that wound and further into our bodies through putting it in our mouth and having it exposed to the capillaries within our oral cavity. Also, I'm one of those who kind of avoids alcohol. It may be effective. However, it is incredibly painful. You'll say all kinds of nasty swears that will lower your professionalism points. So keep that in mind. Peroxide. Now, lots of people like peroxide, but they don't really understand peroxide. Peroxide is for minor scratches only. It is not a chemically stable compound. That's what actually causes that frothing and bubbling that you think is just, oh, how it removes dirt, how nicely, but it can be damaging. So we often don't recommend it for anything that is a deep puncture wound. And that's why I say no cat nail claw marks, because these tend to be deep punctures, and I don't like peroxide getting deep within the body. I have actually seen what happens when somebody uses peroxide inappropriately, working with large cats like I did. Of course, you're going to have injuries, and a very skilled handler had poked himself on the fencing. So it's outdoors, it's nasty and dirty. Well, he says, I've got my own special cleaning solution. And he mixed up water, peroxide, alcohol, and betadine. But then what he did was he put it into a syringe. And he was using the syringe in order to add pressure so he could produce a flushing effect of his wound, which was a deep puncture from rusty metal. However, he couldn't see so well, being slightly older, not putting on his glasses, etc. It wasn't very stable, and he slipped and actually injected the peroxide solution into his hand. This created a horrible effect. His entire hand, fingers and all, his fingers were the size of hot dogs, all the way up his arm was the same diameter. So there was no longer any distinction between a forearm and the lower part of the limb. He lost and still has no sensation in the very tips of his fingers due to the damage that was caused by the peroxide. And it took weeks of me going over there twice a day to help him with salt water, soaks, and going through a whole process trying to draw out some of the extra fluids that have gotten in there and the damage that the peroxide was causing. Also, I'm not a fan of ointments. Okay, I say not on your life for any deep tissue wound. Now, lots of people love their Neosporin. It works great for superficial wounds. However, any wound that may be deep, all it actually does is it allows the topical skin to heal quicker. And when that happens, it can trap infection underneath. That's never good. Also, another thing, most of these are petroleum jelly based, which means that dirt, debris, and other negative things will stick in them as well. And being petroleum based, they also, because that's an oil, repel water. So you can cause pooling and swelling underneath the topical application of ointment. So now let's start talking about what do you do if you actually get hurt, whether it's bit or scratched or cut yourself on something while we're working with animals. First of all, we evaluate the bleeding. Is it spurting, like making a big arc and coming out with pressure? Then guess what? You've hit an artery and you probably have moments to live. We're rushing you to the hospital. Okay. Is it oozing, maybe an awful lot and slow flow? The amount is going to matter because this is venous blood. So it's not always quite as threatening unless you get one of the main return veins. So we judge the amount by the size of the animal as well. If it's not life-threatening bleeding, of course, we're going to continue on to step 2. Otherwise, what we are going to do is tourniquet, direct pressure, do not release, and go directly to the hospital. Step 2 is our washing process. Now, we can do something that I call a blood wash, which is if you're in the field and there's no fresh water, or it's better than dipping your hand in something potentially contaminated, you actually squeeze from either side of the wound and allow blood from within your body to flow out and encourage the removal of physical debris that way. But of course, you're going to have to monitor how much bleeding there is. If the wound is bleeding excessively, we don't need to help it any. Running water is always our best option. Nice, fresh running water. Or if you have bottled water with you, you often don't want to use the water from an animal's feed trough or a puddle that's around. Could be too contaminated. Our rule of thumb when it comes to bleeding is that bleeding should stop in 3 to 5 minutes after we wash the wound. If we're not seeing a significant slow to almost or completely stopped, we're definitely going to be reconsidering the seriousness of this wound. Step 3, one of my favorites, soaking. Who doesn't like a reason to just sit and soak? Well, guess what? You have some options here. You can use salt water, Epsom salt, or even sugar melted in the water. And what I do is I use that after I've done my general washing, and I soak for 10 to 15 minutes wherever the wound is in this warm water solution. While I am soaking, I try to massage fluids. I'm not necessarily encouraging blood flow, but because part of the healing process includes lymph fluid going to the exposed tissues or damaged tissues, I want to make sure that some of that is coming out and that it is not going to just pool up and cause additional swelling and problems. So I want to move my fingers and massage from either side of the wound towards the opening, and this will help to make sure that fluid is not pooling. Now, of course, we want to prevent any kind of infection. So I like to do an antibacterial treatment. You want to air dry the wound first. This way, none of your antibacterial treatment actually slides off. It can stick to the wound. I like to coat it heavily with betadine. Some people say, oh no, be careful. Betadine can be just as irritating to the skin as alcohol. For me, betadine's the best. Now, if you have sensitivities to betadine, obviously don't go the betadine route. What you can use instead is chlorhexidine. Now, either one of these, if you are concerned about the concentration, which is perfectly fine, you can dilute them with water to the color of a light tea or barely blue water solution in the case of chlorhexidine. The reason why I say coat heavily with betadine is normally the solution that you get over the counter is very, very mild, so I'm not really concerned about it being too difficult even for my skin, and I have very sensitive skin, but some people have betadine sensitivity, so please keep that in mind. Again, I want to let this topical antibacterial treatment air dry before I do anything else with my wound. Step 5 is a protective wrap. Now, this does not mean the same thing as tourniqueting, where we're actually trying to stop pressure and flow. So I often use a light wrap that doesn't obstruct airflow. It could even be a Band-Aid. It's just there to keep dirt out, because a lot of wounds need air to heal, and we want some oozing to happen. This light wrap will also help to collect fluids that might be oozing out, and again, prevent dirt from becoming stuck in the wound or contaminating it while it's still open. Step 6 is just like it says on your shampoo and conditioner bottle, repeat. Repeat the entire process 3 times a day until the wound is healed. I like this form of repetition because it keeps the wound clean, allows it access to air, and make sure that you are checking on the healing process regularly. So then when do we see your doctor if you're actually following the steps? One, if the bleeding won't stop or significantly slow within 5 minutes with direct pressure, then we want to consider seeing our doctor. If there is a loss of nerve sensation and feeling, we want to see our doctor. If infection develops, oh yes, let's see your doctor. If you are experiencing limited use and movement, perhaps excessive swelling, I would consider this a time to see your doctor. But if you're following my steps, hopefully that won't happen. And I love to put this one in here. If your mommy makes you, not, I've actually had experiences in the past where students have gotten a wound like a bite from a rat, and their parents have rightfully been concerned and wanted them to go to the doctor. One went to an emergency room, one went to a walk-in clinic, at, I think, a pharmacy. And one of them had somebody tell them to put all this antibiotic ointment on it, and their fingers swelled up so much that they were losing sensation because of that thick petroleum base trapping fluids underneath. So we want to be careful of this and make sure you seek proper medical advice and judge it appropriately. So work with your doctor as a team.